everybody, and welcome to episode 18 of CGI Unpacked. I'm Jackie Durkin, Chief Inspector of Criminal Justice, and I'm going to be the host for this edition of our podcast, which is on the police custody follow-up review. So first of all, I'm going to ask our guests to introduce themselves, and I'm going to start with Una Williamson from the PSNI.
Hello, everyone. Yes, Una Williamson from the PSNI. I am Head of Justice Healthcare and responsible for the transformation of custody healthcare in partnership with a number of health agencies.
Helen, if I can ask you to introduce yourself.
Hi, I'm Helen Coleman. I'm one of the lead nurses and I'm based in Waterside Custody Suite. I started in custody healthcare in 2018, originally as a custody nurse practitioner. And at the moment, I am responsible for the operational management of Waterside Custody Suite.
I'm Rachel Lindsay. I'm an inspector with CGI and I lead on police custody in the inspectorate. So I have been involved in the inspection since CGI commenced them, including the 2020 inspection and this follow-up review.
Good afternoon. My name is Wendy McGregor and I'm the Assistant Director with the Regulation Quality and Improvement Authority, and our role in this inspection was to inspect the accessibility, delivery and quality of healthcare operating in police custody.
So Rachel, I'm going to turn to you first because as National Preventive Mechanism bodies, ourselves, CJI and RQIA, are member bodies of the UK National Preventive Mechanism. So can you explain very briefly what this review was about and what we found in the 2020 inspection?
Okay, yeah. So the National Preventive Mechanism is a group of bodies who undertake regular reviews of places of detention to ensure that there is no torture or ill treatment against detainees. So this piece of work is part of our regular reviews of police custody. In the 2020 inspection report, we reported positively on the experience of detainees in custody and their treatment by custody staff. In the main, staff were respectful and supportive of detainees during a difficult time in custody. The processes for ensuring detainees were quickly and effectively brought through the custody process, and for managing custody across the various custody suites were effective and had improved since we last inspected. We did find some issues around children and the length of time that children, particularly those from looked after backgrounds, those who were resident in children's homes, difficulties in ensuring they were released from cells at the earliest opportunity. And we recommended that there was a need for legislation to address that and ensure that children could return to their accommodation quickly. It was our first kind of opportunity really to review the nurse-led service in its fullest operation in Belfast in Musgrave Custody Suite, and we saw the positive benefits of that process. So we recommended that was rolled out across all the rest of the custody suites.
Thanks, Rachel. And it's nearly 5 years since the original report was published in 2020. From your perspective, can you tell us a bit about what actions you've been involved in that time period through to the follow-up review?
Well, I think firstly, we have rolled out the nurse-led service to Antrim Custody Suite, and now to Waterside, the new custody suite as well. So it is, I think that's around 74% of detainees in Northern Ireland will have access to the nurse-led service, and we're now working on just delivering the last stage of that. So there's work ongoing at the minute with the BHA, SPPG, and Belfast Trust on the next steps. But it has been extremely successful in terms of not just for the police service, not just for detainees, but actually I think for the trust as well, for the health service in terms of interventions with individuals who may have disengaged with the health service over time. So we've a little way to go. I know 2020 is 5 years ago, but we did have COVID in the middle. And what I would like to do is acknowledge the work that Belfast Health and Social Care Trust did with us in terms of ensuring we had a COVID compliant custody suite, so we could look after people that we thought may have COVID. So there was a lot of work in the interim, and yes, of course, we would have all liked to have rolled it out faster, but events got in the way. But we managed those in the interim.
So you said very clearly there about the benefits of the nurse-led unit and the progress of it and the extension to Waterside. So I just wanted to bring Helen in at this point, and as a practitioner, what do you see the benefits of? You've been clearly involved in creating the nurse-led service model in Waterside. So what do you see as the benefits of that to detainees and to the police and to healthcare staff?
I mean, really, as a service, we are really pleased with the positive findings of the inspection and really highlighting the success of the nurse-led model. We have since made really positive steps in reaching and engaging hard-to-reach individuals and progressing our services that go beyond really immediate care and looking towards the healthcare, the long-term health needs of this vulnerable patient group. The nurse-led service has initiated a bloodborne virus screening service, which has allowed for identification of HIV and Hep C. And in doing that, we have developed good relationships with specialist services such as hepatology and the gun clinic. And really, this has been amazing for our patients because it allows for early identification and signposting then to appropriate treatment then after leaving custody. We've also initiated a needle exchange service, offering kind of clean needle provision for our drug using patients, and it opens the door really to have those difficult conversations with people and to provide education around safe injecting practices and general health promotion. I think really, like the inspectors had highlighted as well, that the nurse-led service allows for prompt identification of patient needs and treatment, and we are all really delighted with the positive feedback so far.
Thanks, Helen. And Wendy, I want to bring you in here from an RKI perspective and the findings from the follow-up review. What do you see as kind of the major achievements and what needs to happen next?
Yeah, and I suppose part of this inspection, we were following up on that recommendation that was made in 2019 or 2020 for the rollout of the nurse-led service throughout the region, seeing the benefits at that time for that particular service. We found that, I suppose it was a little bit disappointing to find that the service had only been rolled out in 2 other custody suites during that inspection, because we could see the real benefit of it. Now, we knew that there was a strategic healthcare group that were looking at the rollout of this, but we weren't really completely clear in terms of where that was at. And there was representation there from the respective departments for health and justice. Really limited evidence to demonstrate, really good collaborative working to drive this service forward and to expedite it. We're all very much aware that funding, I suppose, is cited as a real barrier. We could really see the benefits of this service, and I'm not going to echo all that Helen has already said, but I suppose the main point for us is the accessibility of that service, the prompt and timely identification of people in custody in terms of both their physical and their mental health needs, and then their subsequent treatment, which was actioned in a very, very timely way. So that was a really good, positive finding. But I suppose, the concern for us still remains that not everybody has equal access to this service across the region. And that is a concern. And just listening to Helen in terms of what you're saying and the additionality that service brings and the public protection around that as well is really key, that we get this service rolled out to those I suppose, often very vulnerable people who may not routinely come forward for those types of screenings.
Hey, thanks, Wendy. And I suppose that's where, and we've commented on the report, and I've commented in the foreword about that kind of geographical difference and mixed economy, if you like, between forensic medical officers and nurse-led units. So, in terms of what we want to see as a joint and when we're working in partnership with each other, I mean, the message seems to be nurse-led service across the whole of Northern Ireland.
Yeah, I mean, absolutely. And just to say as well, I suppose that one of the things that the inspectors found when they were out was those staff who are working in custody suites, not the nursing staff or the healthcare staff, but the custody sergeants and their staff found this service really reassuring and beneficial. You know, that the people under their care at those points in time who perhaps became unwell or needed some level of attention from a healthcare professional, that was accessed very quickly and very easy. The fact that the service is available 24 hours over a 7-day period.
So, you had pointed to that when I was speaking to you earlier. You were talking about the challenges of the pandemic, and that was part of the reason why the rollout wasn't at the pace that we'd certainly hoped for, and the benefits for police officers. So, is there anything you'd like to say about that? The 20% that still doesn't have a nurse-led model, and how that's going to be progressed.
What I would say now, Jack, I mean, we are now in the final stages of developing the rollout for the rest of the region. And I know I'm just, we do a business case, we do a paper, and we're just looking at what the recurrent funding will be. And I think that's one of the issues that we'll probably face, with justice versus health. And I don't mean to say that it's justice and health together, but we are looking at the cost of this, what it will look like in terms of recurrent funding. But we're very clear as a police service that we will have the rollout in South Region, so that's Lurgan, Banbridge, Dungannon and Omagh. And we're wanting to expedite that as quickly as we can. So we're looking at recruitment by the autumn and then training, because we're well aware that there is a difference in terms of how people are receiving care, and we want to make sure that that is equal right across Northern Ireland within our custody suite.
So you've said very clearly there, that there's challenges around the funding and timing, but ultimately the ambition is to have this in place across Northern Ireland, certainly by the end of the calendar year or shortly thereafter. I just want to bring Rachel back in at a stage. So we've talked quite a bit about, the medical services and the availability and detention, but what were the other things that we found in this follow-up review that still need a bit of attention?
So, as I mentioned earlier, one of the findings of the 2020 inspection report was around the need for legislative reform to address alternatives to custody for children, particularly those children who are resident in a children's home. So the Department of Justice had brought forward reforms to address this, and there were plans in place as to how this was going to be to move forward. But we know, because of the slow pace of legislative reform coming through the Assembly, this is likely to take a number of years before that legislation will be passed, and the actual kind of operational approach to that still needs to be worked out as to how children will be brought through custody in a quick and effective manner. So we would still urge the department to work with its partners in health and in the police to look for alternatives in the here and now, even in the absence of legislation, and a way to get those children out of police cells as quick as possible. The other thing that we considered was around the care planning, so the processes for detainees, for the custody staff to assess the risk for detainees whilst they're in custody, the risks both presented by them and the risks for them, both while during their time in custody and then before they're released. So while they're in custody, a lot of detainees would be under the influence of alcohol and drugs, and obviously those that can create risks for their health and well-being. Again, where we've seen the nurse-led model is embedded, we see that there's benefits for the custody staff in carrying out those risk assessments because they're informed by the custody nurses with all the skills and expertise that they have, and we see that then decisions are made in a more effective way about what level of observation detainees require and how long they need to be closely monitored for. So that will be probably an ongoing issue for the police to address, and we hope that further steps to provide custody staff with better training and support from nurses would help with those assessments.
So, Ellen, I just wanted to come back to you. I'm just mindful, the police custody environment can be very challenging, as Rachel said. Sometimes it's the first time someone has actually come into custody, and sometimes they can be under the influence of substances. For your staff and how staff are trained and how they cope with working in that environment, and as Enid pointed to, the importance of that partnership arrangement with PSNI, how does that work from a practitioner's perspective?
All of our nurses are all really highly trained and experienced nurses, some of which have an A&E background or have worked lone working in the community. And to work as a custody nurse practitioner, our nurses have completed the general forensic and medicine course delivered by the Faculty of Forensic and Legal Medicine, which helps set standards for healthcare in police custody. So we would regularly offer supervision sessions with the team to make sure that all staff are kept up to date and partake in case-based discussions for those difficult cases, because I think in an area really that is so unique and that is just so important, and let's face it, we are always learning. We also would offer training to custody sergeants and to new civilian detention officers as well on a regular basis to offer an insight into the role of the nurse and what our role is and what services we can provide in relation to signposting and treating minor injuries, and of course providing some information on managing those long-term conditions that we would be concerned about, such as epilepsy or diabetes. But it's always something that we are hoping to improve on, and we'll continue to keep working closely with our partners in driving standards and improving our education.
And are there opportunities for staff who work in the different custody suites to get together and train together and share that learning?
Absolutely. We have a really strong education pathway, I believe. All of our nurses are offered non-medical prescribing and health assessment modules on top of their general forensic medicine course. Myself and my colleague have just recently completed our master's there in advanced forensic practice.
Congratulations.
Thank you. And a few of our team have completed their licentiate as well. So education really is key in delivering high standards of care.
So Wendy, I want to bring you back in from RQI's perspective. Is that the sort of thing that is reassuring to you as an inspector?
Yeah, absolutely. I mean, we do look for the skill of the staff who are working in any inspection that we do, and also the competency, and it's reassuring to hear the high level of training and education provided for the staff working there. Basically, we want to see that people have the skills required to look after the people that are in their care. And we also like to see that development for staff as well. I mean, that's very important. It helps with retention, and we all know how difficult it is these days to keep staff where they're at. So it's really reassuring to hear that.
So I want to turn to you again now and give you a chance to share with us about what happens next from the police perspective.
Just from what Helen was saying there, the work that I think the nurses and Belfast Trust have done has been really positive for our staff in terms of increasing confidence in dealing with detained people, and having that 24/7 healthcare approach and working as a team. I know that Belfast Trust have provided training to our CDOs, our new CDOs, and also our custody sergeants, which on their roles, so they both understand what they're doing. So what happens next? Next is the rollout of the nurse-led service to Lurgan, Banbridge, Dungannon, and Omagh. So there's a little bit of work to be done, but we're just looking at what the recurrent funding will support. And I think then we will progress. We definitely want parity of service right across all the suites and make sure that every DP gets the same service. So that's our next challenge. In addition, we still require the services of forensic medical officers for a number of reasons, but we're introducing clinical governance for that. So we've progressed that, and we're just waiting for sign off. And I think that will give us the oversight that we require from the report in 2020.
So there were quite a few of the recommendations that we've assessed as partially or not achieved. So there's a bit more work to be done. And when we come back the next time, as you know, we're going to. I can't tell you exactly when, but you know that police custody is something that we would inspect on a fairly regular basis.
Mm-hmm.
What do you think it might look like?
My ambition would be that we'd have a nurse-led service right across all of our suites. We would have a regional FMO model rather than a per suite model as we have at the minute. I don't think there's a requirement to have FMOs on call to every suite. There's some legislative challenges around the road traffic order, things that we're trying to progress. But as you know, legislation takes time to change. But I would want to see a nurse-led service and a much reduced reliance on the forensic medical officers.
Well, that's really encouraging. And what you're saying is we know that there are funding issues and resource issues across all public services, but we know the particular challenges in health and in justice as well. So if there was that universal rollout across Northern Ireland, so there is that parity of access to services, that would be really welcome and something we would be keen to see as well, as you know. And we do appreciate the challenges of working in that environment for Helen and her team and all the teams in custody suites, and also the police officers. Some of the people that they're coming into contact with, we know, have their own challenging behaviour to deal with. So we're not blind to that as well. Very much appreciated. So that's what was going to end there, and thank you all for participating in our podcast today. And that's hopefully the next time we do a full inspection of police custody, we'll see that universal rollout of the service. But thank you all for participating.